Good morning. Welcome into the program. This is Mon Health Talk. I'm Dave Wilson. Good morning. Welcome into the program. This is Mon Health Talk. I'm Dave Wilson. Coming up today, we'll be talking primary care in Fairmont, and we will bring in a couple of guests to discuss this morning. Joining us on the program, we have Dr. Lisa Flowers, primary care physician, and Dr. Ryan Walker, also a primary care physician, Mon Health Primary Care down in Fairmont. Good morning, guys. Thanks for taking some time.
Morning. Good morning.
We will jump into primary care here coming up in just a moment, but we first have to welcome Dr. Walker into the program and into the area, recently joining Mon Health Primary Care in Fairmont. So this is your first show, Dr. Walker. Welcome.
Thank you. I appreciate it.
Well, thanks for taking some time. Tell us a little bit about yourself and how you ended up with Mon Health.
Sure. Yeah. So, I'm from Bridgeport, West Virginia here originally. So that's my family, my wife's family from the area. I've, kind of my background, from the area, did school at WVU, both undergrad and medical school, and was in Charleston, West Virginia for a little while through WVU. I did my residency in Cleveland, so I was at the Cleveland Clinic at Fairview Hospital and spent 3 years there. And between kind of friends and some family, was in Columbus working for the past 6 years. So kind of got pulled to Ohio, and for a long time it always made a lot of sense because it wasn't too far away and enjoyed the area a lot. But I'd say, my wife and I always talked about, and certainly over the past several years, and certainly as a lot of people say with the pandemic, being further from family became harder. So, we had started talking a lot about trying to get back closer to the area and everything. And so I talked to several practices, several areas, and I was always very impressed with Mon Health as well as Dr. Flower and Dr. B here, as far as the quality of care and everything they provided. Everybody's been great here through Mon Health, with the faculty and the staff and the patients alike. So found my way kind of coming closer to home and being, again, kind of with family still in Bridgeport. The Fairmont area has been wonderful for us, and I've been excited to be back kind of caring for patients here in West Virginia and Fairmont area.
What led you to primary care as your specialty?
Through, I'd say, and families always tell you that, kind of going into medicine, physician always been something I talked about for a long time. I'd say through med school, in my mind, I'd always imagined going into different specialties, but I'd say as I went through school, both in the early years and as I got into my clerkships and found myself doing a lot of the different specialties, I enjoyed a lot of things about a lot of different areas. And I think it's that ability in primary care to treat so many different things, both, establish wonderful relationships with both patients and families, while also being able to care for multiple facets in medicine. It's that kind of, what's saying, the jack of all trades, I guess, kind of thing. And I think that's what through med school and schooling, that ability to do a little bit of everything while also having those long-term relationships, which really led me to primary care.
We also have Dr. Lisa Flowers with us from Mon Health Primary Care in Fairmont. And Dr. Flowers, tell us about you.
Good morning. I'm a family physician here. I've been with Mon Health for several years now. We recently moved our office into the Whitehall area, which has been an exciting change.
Yeah, and I was going to ask about that in just a moment, about that change. But expanding, bringing Dr. Walker in with you guys, and it sounds like things are growing and moving in a positive direction.
Absolutely. It's very exciting. We have been very busy in our office, and bringing Dr. Walker on has helped us to bring in more patients every day and be able to take care of everyone's needs.
All right, you mentioned the office recently moved, so where are you located now?
We're located off of NASA Boulevard in the high-tech area here in Whitehall, back in behind Dan Cava Toyota. If they follow that road back through there, you can actually see our office from the interstate, from I-79.
Yeah, the bright green sign there off the highway, you can't miss it where that
Absolutely.
Location is. How is that location? How is that facility working out for you?
It's a wonderful, nice, new, clean facility. We have plenty of exam rooms, nice, big, open waiting area. We have other specialists in with us. Cardiology is in the same building, just down the hallway from us. We're starting to offer other services as well, including orthopedics. We have a pulmonologist that will be joining us. So we're really able to offer more here than we could at our other location, which was much, much smaller.
Talking to Dr. Lisa Flowers and Dr. Ryan Walker this morning, primary care physicians at Mon Health Primary Care in Fairmont. We're going to take a break. When we return, we'll talk about the importance of having a primary care physician, what is essential to an annual routine checkup, what types of things may fall outside of that category. We'll get into all that. It's all coming up. We're talking to Dr. Ryan Walker, Dr. Lisa Flower, and this is Mon Health Talk, and it continues in a moment, all right here on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Dr. Ryan Walker, primary care physician. Dr. Lisa Flower, primary care physician. Mon Health Primary Care in Marion County, joining us on the program this morning. Dr. Flower, why is it important to have a primary care physician?
As primary care physicians, we can help to treat as well as hopefully help people to prevent some chronic illnesses, also to catch diseases early in their course so they can be much more easily treated. For example, colon cancer, getting your colorectal screening early, you catch a polyp at a very early stage, significantly better improvement.
And Dr. Walker, we seem to do a pretty good job as parents making our kids go to the doctors, see the pediatricians, but maybe as adults, so, you move a couple of times, switch places. Okay, I'll get a new doctor when I get to that area. And that might slip through the cracks every once in a while. Do you hear that story often?
Yeah, I'd say that's not an uncommon story we hear. I think the natural tendency for a lot of us is, we always want what's best for our kids. And like you said, I think, we try to make them do it and press the importance of it, but then as adults, we make excuses. Things get busy, this and that, and it doesn't become, something that we feel is important until I feel like most people, until they get sick. And certainly we see a lot of culture, both, when I was in Ohio, not too much different than, here through my school and everybody I know is that, until you get really sick or there's really a problem, that's when, you're showing up to the doctor and everything as Dr. Flower mentioned, as we say in primary care, kind of an ounce of prevention is worth a pound of cure. It's trying to get these people in early, kind of established. And I think that's the beauty of family medicine is when you have a family doctor, primary that you trust and and you can see, then when there are problems or hopefully you can detect things, early before they become a major issue, and it becomes much easier to treat and keep people healthy in those stages than when we let things become much worse or wait and get on. But yeah, it's certainly something that we see, and I think we try to change. And certainly that's where, having the accessibility and trying to, again, as a new physician here, to open up the availability and have the accessibility to get into a primary doctor, I know is going to be a lot of people's complaints as well nowadays. And so trying to open up that availability and get more people in is also, I think, an important part of that.
And Dr. Flower, I know you've heard this one before. I feel great. I exercise regularly, eat pretty good. Why do I need to go have that annual checkup, that routine checkup with my primary care physician?
There are several illnesses and diseases where people will feel completely fine. For example, high blood pressure, high cholesterol, as I discussed, colon cancer, getting your annual mammogram to find a breast cancer at a very, very early stage. All those things are really important and things that we can do for you here in primary care. So,
Dr. Flower, what types let me approach it this way. Describe a routine annual visit. Again, we're speaking in general terms here, but what can a patient expect who's coming in for their annual visit?
You will have your vital signs checked, including blood pressure. Your doctor should and will go over your family history, make sure that nothing has changed there, see how you're feeling, do a physical exam, and typically lab work and other screening tests as needed depending on your age, such as mammogram, colorectal cancer screening, etc.
And if something looks a little bit out of the ordinary, or, you come and say, I know the question, something along the lines, anything bothering you? Well, I got this pain here, or I've got there's some issues come up. Then obviously you can do follow-up test or whatever, needs to be the next step, right?
Exactly.
And Dr. Walker, when we're talking about routine care, that seems to me like, the annual checkup. If I've got a cold, I'm not feeling well, I come see the primary care physician. But what might fall outside of the purview of routine care?
Yeah, I think, again, sometimes we throw these general terms around when we think of routine care. Like you said, I think we're thinking more your annual physical and that kind of stuff. Certainly, sometimes we categorize them as med checks, people on chronic medications and stuff like that, obviously following up on to make sure that they're following through with keeping track of those medications. And even when you've been on them a long time, it's important to continue to monitor lab work, how you respond to them, how you're doing. I think some of the other stuff that falls outside of that, maybe the acute care stuff, which I think is oftentimes a lot of people's concerns. You get sick, you have an injury, or, you're having, acute symptoms, whether it's, UTI, or certainly nowadays with respiratory illnesses. Certainly we think, again, as primary care, when you know the patients, when you know the families and everything, to be able to have a place to go to, that can help take care of those things. I mean, certainly nowadays with the pandemic, obviously we try to triage a lot of stuff over the phone and try to get a lot of information ahead of time so we know what's going on, so we know what's safe to bring in the office, and what's better suited maybe over the phone or a telemed nowadays. But again, anything from a variety of, whether it's GI issues, symptoms, or UTI-type symptoms, or respiratory symptoms, the acute care stuff that's maybe not your routine stuff, whether it's an acute, just started, or it's been on and off ongoing for a while and just never thought to bring it up or finally got to that point. I think those are the things that, certainly we try to get in as primary care. And I always try to impress upon a lot of my patients we'd rather see you here and talk to you about those things. Certainly we understand the utility and the viability of, urgent cares and emergency rooms, and certainly there's points where those have to be utilized, but I think it's important when it's appropriate to get you into the primary doctor. That way, if it's something that is ongoing, can be followed, I think it can be tracked easier than at, spot visits here and there by, other facilities.
And Dr. Flower, as far as telemedicine goes, how much more important has that become for you, and how much more of a tool has that become over the last 2 years?
I never thought I would be doing telemedicine until the pandemic hit, and now we use it pretty much every day. A lot of patients really appreciate it. We can help to triage things, and sometimes it's really easy to do for certain medicines, such as antidepressants. Once we've seen them in the office, have done an exam, labs if needed, then we can do a follow-up on telehealth. They don't have to take the whole day off of work. They might run out to their car or close the door in their office and have a nice talk with us, and we can adjust medicine very easily that way.
We're talking to Dr. Ryan Walker, primary care physician, and Dr. Lisa Flower, primary care physician at Mon Health Primary Care. And we will continue the conversation. Just got to squeeze in a quick break. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Our guest this morning, Dr. Ryan Walker, primary care physician, Dr. Lisa Flower, primary care physician at Mon Health Primary Care in Fairmont. And also, it hasn't been too long ago, Mon Health recently opened the Mon Health Marion Neighborhood Hospital. And Dr. Flower, what does that expansion of services mean for patients in Marion County?
Well, that facility, if anyone hasn't been there, is beautiful. It's located in the Middletown Commons, right across from Colosesnos out here in Whitehall. Most people know where that is. And that facility has brought a lot to our area. We now have another emergency room in the area. They also are able to hold patients there and have some inpatient beds for anyone that needs to be held there that comes into the emergency room, or they will send them on, if they're a more serious patient, on up to Mon General if they need surgical care or something there. As well as my patients are able to utilize that facility to have immediate x-rays. I have sent people over there to have outpatient x-rays and had them back in my chart within 30 minutes. So it is wonderful, it is fast, convenient for our patients.
And it provides, Dr. Walker, that neighborhood hospital idea. Ruby's a big place. If you go to Mon General, obviously up in Montague County, it's a big place if you have to go to one of the other cities further north. This is a neighborhood hospital with neighborhood roots, and, it's like yourself, locals coming to see locals, and there's something to be said for that, isn't there?
Yeah, I agree. Again, it's certainly having and I think in this area, having the utility of, Ruby and Mon General and some of these bigger hospitals around. Obviously, there's situations where those are needed, but I think a lot of people, and as a physician in primary care, having the neighborhood resources to be able to keep people and get them what they need, whether it's, as I said, some outpatient imaging or it's something more serious that we can't take care of here in the office, to not have to send you, up to, Mon General or get you what you need. Sometimes it's, IV fluids or something like that, having the ER and an overnight stay and everything, and be able to do it with a community, hospital emergency room and keep people within the area and the care they need, I think is invaluable.
Dr. Flower, if someone's listening this morning going, it has been a while since I've had that routine checkup, how can they get in touch with your office?
They can call our office, 304-368-2422, and schedule an appointment.
Do you take walk-ins or same days?
We do have some same-day appointments available. I recommend everyone always call ahead just so that we can fit you into a more convenient time than walking in. But we will gladly take care of your needs.
And I'm going to toss this question to each of you, give you an opportunity to answer, and I'll start with you, Dr. Flower. What's the main idea you want folks to take away from our conversation here today?
It is very important that you see your primary care provider on a regular basis so that we can help to keep you healthy, find things earlier, and so you can lead a happy, healthier life.
And same question to you, Dr. Walker. What's the one thing you want folks to take away today?
Yeah, I think I'd echo a pretty similar thing as we've talked in our conversation here is the importance of, establishing, finding the, primary doctor, somebody that you can trust, have a relationship with. I think there's, beyond keeping you healthy, and we've put a lot of time on prevention, I think that's important. There's certainly always unexpected things that happen in life and in health, and to have somebody, a physician that you trust and somebody that you can call, or, sometimes it's have an opinion, know where to go, know what the next step is. I think, in primary care, we're often that resource to try to direct people to try to navigate the health system, as well as, have somebody to help in preventive care, but have that person that can kind of help direct you through the system, which we understand can be confusing at times. So
you can get more information. You can go to monhealth.com/primary care. And, of course, always more information over at the Facebook page as well. Our guests this morning, Dr. Ryan Walker, Dr. Lisa Flower, primary care physicians, Mon Health Primary Care in Fairmont. Thanks so much, guys. Enjoyed the conversation.
Thank you.
Thank you very much. Appreciate it.